Okay, pardon me for having a really strange nasally voice, but we're going to go over chronic low back pain. With this, we're talking about mostly one-sided low back pain. You could have both, but predominantly one side. And when we talk about LMM, we're talking about the lumbar multifidus muscle. What does that mean? It's basically, all you have to know is it's the muscles that are they run along the sides of the spine, up and down. They'll go along most of the spine. But particularly, we're talking about the lumbar section, which is down here. Those little muscles that go right through there. So, Freeman in 2010 had a study, and they found that if you have low back pain, you will get fat deposition and atrophy of the lumbar multifidus muscle. That means you will have fat deposited where the muscle should be, and where the muscle is, it will actually get smaller. It will shrink in size. So obviously that's not a good thing that you want for your low back. And what they found here with Hides in 1996, several years earlier, was if you have unilateral low back pain, so back pain on one side, there is up to 25% difference in the muscle size of that lumbar multifidus muscle, which is responsible for stabilizing the spine and helping with movement and mobility. So you can see how it would be a problem if it's getting increased fat and decreased in size. So 25% difference from one side of the low back to the other. The side that had the pain had more atrophy or decreased size. So what they did was 4 weeks of strengthening for the low back to target that muscle, and after that, 0.7% decrease in muscle size continued in the exercise group after 4 weeks. There was still a 16.8% difference, a decrease in muscle size after 4 weeks in the group that didn't do any exercise. They basically just took pain medication and just waited until it got better. After 10 weeks, 0.2% decrease, so basically it's back to the same size, and still 14% decrease in muscle size in the group that didn't exercise. The interesting thing is here is that after 4 weeks, both groups were pain-free. So despite the fact that the muscle is decreased in size still, they didn't have any pain. So what does that matter then? Pain recurrence. So if you don't have any pain in this group, why does it matter if you would exercise? You may as well not, because you'll feel just as well if you do exercise as if you don't. But here's what they found. 80% of the individuals that did not exercise in this and still had that decrease in muscle size had recurrence of low back pain, whereas only 30% in the exercise group had back pain again, come back after a year. So the importance then would be, if you have chronic back pain, increasing that muscle size, that way it doesn't continue on and on and on again. So that's the first portion, and then we're going to go next time into the 3 exercises that were shown to increase your muscle size and decrease the fat deposition. So basically what your treatment would be, or how you would exercise in order to target that multifidus muscle.